Ketamine assisted therapy is a really useful tool and exploding in popularity, but it's not right for everybody. So I have with me Fraser Johnston. Fraser pioneered the Odyssey Method, which is a holistic approach to psychedelic assisted therapies. Fraser is also the CEO of Entheomed, which is a world leading clinic in psychedelic assisted therapies. So, Fraser, who is not a good candidate for ketamine therapy?
So ketamine may not be appropriate for people with certain medical conditions like excessively high blood pressure, or if they've had like a recent brain aneurysm, or maybe specific psychiatric histories, like they've had recent psychosis, definitely not active substance abuse, or just people who may need more stability in their life circumstance before trying treatment.
And what does the screening process look like for someone who might be considering this as a therapy for them?
Yeah, so ketamine definitely works best, and also it's safest when it's offered through this traditional medical model. So every client we work with goes through a screening. So they will do a mental health screening and a physical screening. So with the mental health screening, is really looking at your mental health history, what's worked for you, what hasn't worked, what's maybe giving you some relief as well. And then on the physical side, we make sure we do things like blood pressure checks and also a full medication review to make sure there's no contraindications with the medication.
Okay, and so what if someone like wants to sign up for the Odyssey Method and like start their process? They fill out the intake form, uh, which you can get using the link below this video. But if someone signs up for that and they go through this process and they found out they're not eligible, what does that exactly mean, right? Like, does that mean that it's like some temporary health things like high blood pressure that they need to fix, or is that like you're never eligible for it, or you can come back later? Like, how does that work if someone is not approved for ketamine assisted therapy?
So great question, Mark. So yeah, not being a candidate today doesn't mean never. So yeah, we always say you're not a fit right now. So what we do is we do build a plan with all of our clients. So if they are committed to continuing with ketamine therapy, we will work with them to, for instance, reduce their blood pressure, help them with their medication, or maybe if you even need more therapy appointments with a therapist so they are emotionally and mentally ready for that non-ordinary state of consciousness. So yeah, it doesn't mean never. It just means we will work with the client and to ensure they can be a fit in future.
And at the Odyssey Method, like with your process, who is like an ideal candidate? And maybe talk about like what issues potentially you mainly treat with using the Odyssey Method.
Yeah, so the most common ones we see at the clinic are depression, anxiety, PTSD, and more commonly now we are seeing a lot more people with a burnout referral. So for us, a good candidate would be someone stable with their mental health. They have a stable life circumstance. They haven't just been fired or going through a divorce. A really active emotional state. So really with us, it's people that, they have a bit of self-awareness and they have tried other things. They've been working with other healthcare providers, whether that is through therapy or antidepressants. So really we look at this as, stable life circumstance, and they're coming in and we can be that added catalyst for them to really see if we can shift their condition.
What if someone isn't working with any sort of therapist or on any current antidepressant drugs or pharmaceuticals right now? Is someone like that able to, start with a ketamine assisted therapy?
Absolutely, Mark. So with our clients, everyone who goes through the treatment first time, is we give them lifetime access to our app, Odyssey Online. So there's some really good educational videos in there. And there's also other healing modalities like breathwork, meditation, and yoga. So these other modalities can help regulate the nervous system and everyday waking life. And every client for their first time does do preparation and integration therapy. So those therapists on our team are skilled psychedelic assisted therapists. So they can really help the person prepare for the experience, but then also integrate any insights and emotions that came up afterwards. Because the integration piece is so key of, how are we actually helping change some of the behaviors or thought patterns that person is looking to get to the root of. So yeah, that for that process too, someone might require to do the prep and integration therapy for maybe 2, 3, 4 sessions. Sometimes if people have their own therapist, they might only work with our team for maybe the first or second treatment, and then they'll be doing their prep and their integration with their own therapist if they've been working with them for a long time.
And if you want to see if ketamine assisted therapy or psychedelic assisted therapy using the Odyssey Method is right for you, then use the link down below this video and you can start and download a discovery guide, or hop on a call with actually one of Fraser's doctors at his clinic at Entheomed. And of course, talk to your doctor as well. And subscribe to Fraser Johnston on YouTube, because this is where we're talking about ketamine assisted therapy and all sorts of psychedelics and alternative and holistic therapies that are available and out there in this world. And we will see you in the next video.